What if you could see tomorrow's health challenges today? In public health, that's not just wishful thinking. It's the very foundation of how I plan, protect, and prevent. Let's talk about the power of trends and forecasting in public health data. First up, trends. Picture a line graph showing how something like smoking rates has changed over the last 20 years. Maybe you see a steady decline, with little dips every time a tax goes up or a ban takes effect. That's a trend, a record of how things change over time. Trends can reveal steady rises, sudden drops, or even seasonal patterns, like more flu cases in winter. They show me what's already happened and help track what's working, or not, when it comes to public health interventions. But what about what's next? That's where forecasting comes in. Forecasting is my crystal ball, powered by data, not magic. It takes current and historical information, runs it through mathematical models or machine learning, and predicts what might happen. During COVID-19, for example, forecasting helped anticipate hospital surges, plan lockdowns, and target resources before a crisis hit. In everyday work, I use forecasts to predict when flu season will peak, how many ICU beds might be needed, or where vaccine uptake could lag. Here's how I like to think about it. Trends are my rearview mirror, telling me where I've been. Forecasts are the windshield, showing where I'm going. If a trend shows asthma cases spike every summer, I can use forecasting, plus pollen and pollution data, to predict how many emergency cases might come next month. That means I can act before people start arriving at the ER, increasing awareness, getting inhalers into clinics, and focusing on high-risk communities. The tools? For trends, it's things like time series graphs, moving averages, or breaking down data by seasons. For forecasting, it's everything from traditional statistical models like a rhymer to cutting-edge machine learning and simulation models used in infectious disease outbreaks. Real-world wins? Forecasting has helped manage outbreaks, shape obesity policy, plan vaccine campaigns, and even prepare for heat waves as the climate changes. Combine that with robust trend analysis, and I can move from reacting to problems to stopping them in their tracks. Of course, there are challenges, like patchy data, unpredictable human behavior, and the tricky task of communicating uncertainty. A forecast isn't a promise, it's a scenario, built on probabilities. But here's the real opportunity. With better data and sharper tools, I'm not just counting cases, I'm preventing them. I can focus preventive action, allocate resources, and protect those most at risk before tomorrow's crisis arrives. So, trends show me where we've been. Forecasts help shape where we're going. Together they let public health see around the next corner and build healthier communities, one smart decision at a time.